Hello, my name is Deanna Roberson. The title of my presentation is Cognitive Behavior Therapy, an Effective Treatment for Depression in Adults. Depression is defined as a mental disorder characterized by symptoms of feeling down, depressed, hopeless, and helpless, having low energy, poor concentration, appetite, and insomnia. According to data from the CDC's National Health Interview Survey, 1 in 5 adults aged 18 and over in the U.S. reported experiencing depressive symptoms. There was disproportionate levels of depression as well. Women had a higher incidence of depression among the population. Adults aged 18 to 29 had the highest incidence of depression, followed by ages 45 to 64, next ages 65 and over, and lastly ages 30 to 44. Untreated or poorly managed depression is a precursor to other maladaptive behaviors such as suicidal ideations, homelessness, substance use, and job loss. The title model is a theoretical framework that was developed by Phil Barker from a 5-year Newcastle study. It was utilized in acute psychiatric settings in the late 1990s. Elements of the patient's life experiences are expressed in metaphoric nautical terms such as water, drowning, piracy, and self-hating. Like most patient-centered models, the patient's voice, life experiences, and associated values are the change catalysts. Therapeutic engagement focuses not on past experiences or behaviors, but on the current steps towards recovery. In essence, the patients are empowered to recreate their future, set their own goals. The title model addresses the unpredictability of life in 3 dimensions: world, self, and others. World emphasizes the need to be validated and understood. Self emphasizes the emotional and physical safety. Others emphasize and highlight the support system needed to maintain stability. The narrative elements of each dimension are incorporated into patients' care and safety plans. Moving on to literature review. 3 studies were reviewed: 1 randomized controlled trial systematic review, 1 non-randomized controlled trial, and 1 qualitative study. Study participants consisted of adults aged 18 to 79 who were diagnosed with depression with completed CBT therapy in an outpatient setting. Outcomes were measured immediately post-CBT intervention. Primary outcomes were measured by decreased depressive scores, and secondary outcomes were measured by improvement in quality of life. Each study reported a decrease in depressive symptoms as early as 6 weeks post-intervention. Each study also reported an increase in quality of life, which included general and physical health, social relationships, and environment. The most favorable CBT delivery method was face-to-face or individual or group therapy. The most effective CBT component was homework and problem solving. Each study noted that the therapeutic relationship between therapist and client was also important. The significance for nursing practice. Literature supports the feasibility and efficacy of low-intensity psychotherapy for the treatment of mental illness. By reducing depressive symptoms and establishing supportive links and foundations, maladaptive behaviors such as suicide and substance use are replaced with sustainable coping mechanisms. Findings by Haller, Gu, and Lopez suggest that depressive symptoms could be lessened following brief cognitive behavior therapy intervention. Improvement in quality of life leads to better self-awareness, value, healthcare outcomes, social relationships, lifestyle, and environment. Cognitive behavior therapy. Cognitive behavior therapy is guided, low-intensity, self-directed psychotherapy that is normally delivered in 6 to 8 short-term therapy sessions. It can be facilitated by any trained multidisciplinary staff. Therapy intervention tools include cognitive restructuring, journaling, behavior activation, stress reduction techniques, exploration, relapse prevention, and psychoeducation. CBT also, like the title model, uses the patient's voice, experiences, desires, goals as catalysts for change and self-empowerment. CBT has various delivery modes, such as face-to-face, group therapy, telephone, and/or computer video conferencing. CBT can be successfully implemented in any situation. For this presentation, the recommended area for implementation is outpatient mental health or integrated primary care clinics. The reason being, or benefits of these locations are routine screenings for depression, suicide, homelessness, and substance use. Integrated primary care clinics can offer behavioral health referrals for CBT intervention or therapy to individuals experiencing depression along with comorbidities. Either clinic employ multidisciplinary staff capable of facilitating CBT and monitoring treatment outcomes. Continuing aftercare and support can effectively be managed. In closing, literature endorses the use of CBT, the different modes of delivery, make it an efficient tool for the treatment of depression. Thank you.